Good evening, Dr. Washburn. My name is Jenilyn Gray, and I am a student of Nursing Informatics, and this is my presentation. In this presentation, we will define what teleneurology is, when did it start. We will identify the current uses of this technology and the evidence surrounding it. We will identify the advantages and disadvantages of teleneuro, if there are any legal and ethical considerations, and lastly, our Christian perspective. So, what is teleneurology? Teleneurology is a branch of telemedicine where the provider runs remote diagnosing, treatment, and management using electronic information and computer technology. That said, teleneurology aids the neurologist in assessing a patient's neurological status without physically being in the room with them and was introduced in 1999 by Levine and Gorman. For decades, teleneurology was used to provide stroke management care. Today, the COVID-19 pandemic has rapidly expanded telemedicine. With that, teleneurology expanded to other neuro subspecialties like neuro-oncology. Because teleneurology is a real-time audio and video, it can provide a prompt assessment and evaluation of patients with an acute stroke. In some rural areas where a facility does not have a neurologist, teleneurology can help close the gap and improve the quality of care by providing access to stroke or neuro specialists. In addition, Adelman and Leppert state that research found that the application of teleneurology in inpatient units decreased the length of stay and mortality. Treating patients using teleneurology in their current facility also avoided costly transfers. So now we're going to identify any risk of privacy and confidentiality breaches to patients, families, or caregivers. An article by Kim and his team identified two security risks of telemedicine, which also applies to teleneurology. Data breaches due to vulnerabilities in computer systems and cyber attack risks. Information leakage, to which HIPAA breaches are also at risk. Teleneurology must be delivered at a secure and a HIPAA compliant communication system. Let's move on to discuss the advantages and disadvantages of this technology. We'll start with the advantages. The COVID-19 pandemic has changed many of our ways. We now wear masks and practice social distancing. Teleneurology has proven to be a way to provide quality care while limiting patient contact to prevent the spread of contaminants. An example provided by Adelman and Leppert was the Medical University of South Carolina's application of teleneurology to provide medical education while keeping exposures to a minimum. And as mentioned before, teleneurology offers prompt responses to consultations, significant reductions in length of stay and mortality, and decreased costly transfers. It also limits the travel of the patient and the physician. Another advantage is the family's opportunity to be present during a consultation if accurate information is needed. Even though teleneurology comes with many advantages, it also comes with limitations. Video encounters do not provide sensation or reflex assessment unless done by another healthcare provider at the bedside. It can also be a barrier to the older population due to hearing and vision issues. If there are any connectivity issues, it may not provide efficient communication between the patient and the provider. Telemedicine requires the user's proficiency. Resources are used to train appropriate healthcare providers. This type of technology also would require reliable broadband internet and communication devices to which some patients do not have access to. Let's address any legal and ethical considerations on the use of this technology. Virtual consultations must be treated with professionalism, respect, and security like in person visits. Data privacy and security must be enforced. Informed consent regarding the risk and benefits of remote therapy and research must be obtained. Another primary concern with teleneurology is the patient provider relationship. The clinician must provide additional care and sensitivity when delivering news to a patient. Also, given the limitations stated in the previous slides, not all neurological diseases can be assessed accurately on video. Patients that require detailed examination must be done in person. In my nursing career, I have practiced in emergency departments where teleneurology is and is not utilized, and I have witnessed its advantages and disadvantages firsthand. Having in person neurologists, I found that the provider's assessment during stroke cases was done accurately, right down to the reflexes and sensation. The doctor can also establish rapport with the patient and the family by providing firsthand information. I also found that nurses can talk to the doctor when they have questions immediately. For the other facility that I have worked at, teleneurology is utilized. During stroke cases, I found moments when the computer system was not functioning correctly and an assessment of the patient was done with the help of a stroke nurse or the primary nurse. However, if no issues were encountered, prompt evaluation and treatment were provided to the patient. In my opinion, teleneurology is beneficial overall. However, ensuring that equipment is functioning correctly and communication established to provide quality care to our patients is necessary. So now we're going to integrate our faith principles into the presentation. Does this technology go against biblical teachings? According to the Bible, and God blessed them, and God said to them, "Be fruitful and multiply, and fill the earth and subdue it, and have dominion over the fish of the sea, and over the birds of the heavens, and over every living thing that moves on earth." Genesis 1:28. With the creation and technological advancements, we must remember that we are God's creations and must triumph over technology. Technology is helpful in healthcare, yet it is but a tool to aid us to fulfill our calling to help our patients. This technology does not go against biblical teachings. According to the scripture, technology is only a tool. Humans may choose to use it for good or evil, and teleneurology is used to provide prompt treatment to patients, especially in areas that do not have access to a neurologist, making this technology good and moral. So, in conclusion, teleneurology is widely used due to the advantages it provides. Healthcare professionals must evaluate and ensure patient satisfaction with teleneurology. Informed care and shared treatment decisions are vital, and open communication promotes patient provider relationships. Providers must also assess the patient's condition and determine if an in person visit is necessary. Thank you for listening, Dr. Washburn. Here are my references. I have used the stock images from PowerPoint, and according to APA, I do not need to cite them. Have a blessed day.